Everybody doing okay? So yeah, are you ready to approve? Just pull the wings back. Perfect.
It will make that.
It will make that click, yes. I think I have everything, and so once you and Kim are done, if you would please take off your gloves the right way. Remember, you're gonna pinch, and then pinch one, and then pull over on the second one. Awesomeness. I have a trash can here. And then if you would really go, you can throw away any other supplies that you need to throw away. If you're really gonna wash your hands. Okay, 20 seconds, pretend you're about to take your CNA exam. And then Kim, same for you, when you get through, if you'll really wash your hands for me, okay?
Yeah.
I don't plan on bleeding a whole bunch, but just in case. Let's see here. What was that from about, Kim?
Re-sanitizing. Had it in the wrong hand.
Okay. And you're doing okay up front, Haley?
I have a question.
Okay.
So when I was pulling it out, I noticed that the needle, like, was showing.
When you pull it out, you'd be putting it into the sharps container, so whether the needle's showing or not, it would not be a factor for you.
Okay, but like, I was pulling this out.
You were pulling this out and
Yeah.
this needle was showing.
Yeah, like, the needle was showing here
That's
when I
fine.
pulled out this.
Okay, so you pulled this out and the rubber was back and the needle
Yeah.
was exposed.
Yeah.
How would that be a factor for
It's
you?
contaminating it.
Well, so that's something that I wanna teach you now. That's what it's supposed to do.
Oh.
Yes, cause otherwise the blood won't transfer into this. And so we're not doing a blood culture. If this was a blood culture, it'd be a different technique. And so if it was a blood culture, I'd be worried about the contamination, but this also could have been something that we reused. So I'm not sure if that could have did it too. And because this has been going, we've entered this one so many times, maybe that was a factor as why the needle stayed exposed.
Okay.
Okay, but what you do in the real world, you wouldn't even take this off. You put this whole contraption in your sharps container.
Oh.
Yes,
Okay, so
but,
the whole thing.
yes, the whole thing. For classroom purposes only, we're doing that, secure. Kim, and after this one, were you able to, pull your wing back?
Yeah.
Okay.
Is it improper to do it as it is in the arm
No,
to pull
no,
back?
you only,
So if I'm doing it this way,
you'd be applying pressure.
so
So-
take it out and then pull back?
So one hand needs to be applying pressure on the insertion site, apply pressure, good.
And
Okay,
then I
and
just-
now you take this all the way out, because it's still an exposed needle, and now you need your two hands on this one, go ahead and put two hands on it, and then you pull it back. So, but you don't want your fingers close to the needle, you're just gonna pull back on one wing. Remember, your goal is to stay away from that needle,
Okay.
okay?
And one thing,
Mhm.
yeah, we can't have it like this, right? Or you can't have it.
You can't have it inverted, because where preservatives will touch that needle, and that will be contamination. So you always put that blood collection device or that valve downward. Yes, perfect. You're welcome.
Good for you. I do not like the OR. The OR was not my thing.
I love OR.
And I can't stand the smell of that cauterization.
Yes.
I feel you,
I just can't do
yes.
it.
As soon as you
I
walk
feel like I
in,
went home and I smelled
You
like it
can
all
smell
day.
it, yes, I don't know how they do that.
it's like as soon as you walk into a different room, whether in your house, your car, or anything, you smell that again.
So I'm gonna be moving this. One glove, and you still haven't taken those gloves off correctly, ma'am. We're watching
The
you.
first glove.
The first
Then,
glove,
like,
the
my nails were hurting.
and those fingernails, like my nails were hurting. So can we convince you to take those nails off yet?
Oh, yeah.
Okay.
She said definitely
Yeah, because I saw yesterday, it looks like your nail was hurting also.
And at the end of the month, I'm starting a job. And they're gonna-
That's it, then.
yeah.
My program, you can't even have nails in nail polish. So every class they check our nails.
Yeah.
I can only have them during my semester break.
Okay, trying to make sure I can see this table. Sorry, you all make a much better nurse than I do a videographer. So I'm trying to get this right so that you all can see what's about to happen next. Who's gonna go first, Naomi? Naomi's like, yes, it's gonna be me. All right.
Ready?
So Naomi, I may need a little bit of help from you, and you'll be on this side over here.
Okay.
I just may need for you to move this camera.
Okay.
And actually, I think it's gonna be okay. Yeah, I think they can see.
Okay.
All right, so you have, thank you so much. Thank you, Laura. How are you doing today?
Good, how are you?
No patient's ever gonna be happy to see the vampires, just FYI.
It's not gonna hurt, don't worry.
Oh, no, you're not supposed to tell me that. That is an untruth.
Maybe a little bit.
So how long you been doing this now?
Just started.
So I'm not gonna distract you. Tube holders here, you move everything you need. And something we've not been doing before is, most of your facilities don't like you doing this, but I want you to go ahead and do so. We're gonna take a Band-Aid. You don't want to ever have the gauze part contaminated, but I'm gonna take this Band-Aid and on the very edge of your table down there.
Okay.
Don't do that in nursing school.
Just realized.
Okay. Are we using the manual?
Yes, yes. And then I just wanna make sure we're looking at the expiration dates, and I think I did everything right. And you have a trash can down below.
Okay, and I think I looked at the expiration date too.
Okay.
Don't worry, my hand's not gonna shake. We practiced that enough. Okay.
Could someone give her a blood collection vial? Doesn't matter what color.
And can I also get a tourniquet?
Here's a tourniquet for you. Thank you so much. And you wanna do vein selection? Okay. You just automatically know she's going for my antecubital. Alright, so you wanna do your palpitation, you wanna palpate. If I get you to move over just a little bit so you can see okay? And so when you palpate, you don't wanna palpate with your thumb, because there's a possibility you could be filling an artery, even though we know that's a vein right there. And so we just want you to use your index in order,
Okay.
okay? And so it's bouncy, you wanna bounce, press and bounce,
Okay.
okay? Four, 5, 6, 7, 8, 9, 10. Great job. 10 seconds. Circular motions. About 3 inches above. Good. And if you make it super tight on someone who has a really good flow of blood, or someone, if they're elderly, you can actually include the blood flow. I think that's good.
That's good.
And you'll know it's good because what happened to the vein?
It popped.
It popped, okay? And she did not touch it, she just got like real close, like it popped.
Alright.
Alright, and so last time we were having issues with like supplies. Do you have everything you need, like your valve? So
Yes.
which hand are you gonna be inserting the valve into the tube holder?
My right hand.
Your right hand, so maybe bring your valve a little bit closer. So it's right there,
Okay.
okay?
Okay.
Let's see what you remember.
Alright.
Bevel up, wings up. It's a little bit easier if you do bevel up and wings up.
Okay.
Good job, you didn't. And so this hand's going to, you're gonna pull the skin down tight. You see it right there, you see a little knot?
Mm-hmm.
And then just about, you're on the side of it, like right there, and only about maybe a third of your needle. 1, 2, 3. All right, stop. Look for backflash. Now you want to go ahead and anchor. Oh, you all are pros. And just a little bit of blood, like, and now pull it back out. Thank you. And now what do you want to do with the valve?
Oh.
Yep, because it has to Very good. For classroom purposes, just throw it away. And don't pull that needle out yet. What comes first? You can place the Band-Aid there.
Yeah, I was gonna.
Okay. Great. And now hold this. All right, you can go ahead and pull the needle out. I just want you focusing on the needle. And now retract those wings. And everybody give her applause. Great job. Let me keep the tube hold. Oh, sorry, no, you're fine. And then that way, we can use the same tube hold on everybody. Be careful. Yes. Yay! All right, yeah, trash. And let's watch you take off your gloves.
Alright. I've been practicing this, so it shouldn't make a mess.
Very good. And there's some hand sanitizer around the corner. Very good. Good. All right, so Kim, are you ready there? You have the other arm. You have this, Kim. You have this. Kim, if you'll bring a tube, please. Or, can I get you to reach for it? Would you bring the camera closer? And then kind of angle it. So closer and then angle
This
it
way?
towards.
Or this way?
Yes.
Right there?
Perfect.
CBC on
Okay, you're gonna do a CBC.
Yeah.
I should have recorded mine.
Hi, I'm Kim.
Whenever we do our individual videos, with your partner's permission, you can record. I don't want to record you all because I want you to have that I want you to have the privacy and the luxury to learn without being on camera.
Okay.
Okay.
Hi, I'm Kim. I gotta get some blood for the doctor.
Oh man, only time y'all come in to see me is when y'all want my blood.
Yeah.
How long have you been doing this now?
I've been doing this for a little bit, but you know, it's the first time for everything.
Oh. All right, so we're getting our supplies together, and then after that, remember the only new step is making that the Band-Aid available, because last time with the mannequins, we really did not peel back the adhesive. Great.
No.
Okay, it's okay. Okay. Yeah, you're fine.
So how long you been in?
Sound like I've been in jail. I've been only since 9 a.m.
Oh, okay.
Alright, so go ahead and prepare your Band-Aid, and remember you have to keep the gauze clean, so when you peel off one piece of, you wanna maybe put this on the very end of the table so the gauze does not touch the table. Okay, and remember, can you do that in nursing school?
No.
No.
I know some nurses just like let it hang on the side of your arm.
Oh,
then-
but then I'm hairy.
I don't put it on my.
Yeah, I'm hairy, so I don't wanna put it on my arm or their arm.
Oh, like they just like measure it and then peel the other half and like just let it hang, and as soon as they're done with it,
But what if they miss?
I don't know. They usually do that on me, so I'm just like,
Okay. Well,
Oh,
that's one way to prevent from contaminating it with,
anything else?
yeah.
Yeah.
I'm not going to judge anybody who can get the IV on their first attempt or the vein on their first attempt. But if you go to nursing school, it's teach you all these different techniques, and everything we do in the real world is usually not what they recommend in nursing school.
Yeah, that's what I was gonna say about the tourniquet, cause that's how they even teach me, you know, where I'm at now, to take the tourniquet off as soon as you see the flash, and I'm not feeling my tubes, so.
Okay, before you remove that, what needs to happen with my skin? You have not cleansed it. And this is really tight, just FYI. So if you'll put that Band-Aid down, I'm sorry, put the gauze down, and release this a little bit. I tried that.
Sorry.
Definitely taking one for the team. Go team! So maybe just less, yeah. Because if you make it really tight on the elderly person, you can actually occlude the bloodstream, so you won't get any blood.
Good.
Okay. Good.
Better?
That's better. Thank you so much. And pull that glove back if it's gonna be a distraction. Pull it back on your finger some, because it looks like it's sticking. Okay. All right, and then how long, for classroom purposes, it's okay if we go longer, but how long should the tourniquet be in one spot?
1 minute.
1 minute. So we have about 40 seconds left. 9, 8, 7, 6, 5, 4, 3, 2, 1. Great job. You've cleaned. Alright. Okay. Bevel up, wings up. Hold my skin tight with your right hand if you're left-handed. Okay, good. And just about 1/3 of the needle's going in. Go, go, go. Okay, stop. Secure wing. Whew, you did it. All right, secure wing. And so the only thing we didn't do was good. She got it, everybody. And
I'm
just
sweating.
a little, it's okay to
You're
sweat.
doing great.
All right, just a little bit of blood. That's enough, that's enough, that's enough.
It's like as soon as you
One.
put it in.
2, 3.
Good
4.
job for classroom purposes. Throw it away. Real well, you'll save it to label it.
My Band-Aid.
And I'll help you from here. All right, before you pull out that needle, what do you have to do?
Oh,
Take off the tourniquet. Good job. And now you focus on that needle. Pull it out.
pull it out.
And now get it, stand it up so you can see it. All right, you want to pull those wings back. And now you could throw away the entire appliance. Everything in the trash. Applause. Very good. All right, so we're going to stop our recording. Everybody go wash your hands, go take a break. And when we come back, we'll have stations set up